Okay, this is the valgus stress test. Any pain there? We're looking for reproduction of symptoms along the medial collateral ligament, and we're applying the valgus force. All right, this is the varus stress test. All right, so we're going to be looking for reproduction of symptoms, pain along the lateral side, or gapping along the lateral side, or compressive pain on the medial side. All right, this is the third digit extensor test. So I'm going to be palpating for the extensor digitorum here. I'm going to have the patient extend his middle finger. Can you hold it there? Mm-hmm. Okay. Now I'm going to try and push you down. Don't let me, okay? Hold, 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 hold. Good. You can relax. Any pain?
No.
Okay. We're looking for pain along the extensor digitorum tendon, and that's indicative of potential lateral epicondylitis. This is the golfer's elbow test. We're going to start in elbow flexion. I'm going to go ahead and extend the patient's fingers and wrist. And I'm just going to be extending the elbow like this. And I'm looking for pain along the medial epicondyle. All right, this is the elbow flexion test. So I'm going to have the patient put his elbow in full flexion and wrist extension, starting in anatomical position. And I'm going to have the patient hold this here for 3 minutes, and then I'm going to see if there's any reproduction of pain along the ulnar nerve distribution. This is Tinel's test. I'm going to go ahead and palpate for the ulnar nerve. And then I'm going to give it a tap. I'm going to see if there is reproduction of symptoms along the ulnar nerve. Anything? This is Wartenberg sign. So I'm going to have the patient start off with all of his fingers spread in an abducted position, and then I'm going to ask him to move his hands together, fingers together in an abducted position. Any problems there? No? Okay. So what we're looking for is if the fifth digit does not adduct, then we know there's a problem there. All right, this is the test for the pronator Terry syndrome. So what I'm going to have the patient do is I'm going to have him resist the motion of supination. So you're going to go ahead and resist that same motion that I was showing you, okay? And then as I'm doing that, I'm going to extend the patient's elbow, okay? Ready? Yeah. And if there was pain there, it would likely be along the median nerve distribution. And that's obviously the pronator teres is innervated by the median nerve, so we're looking for that. Okay, this is the pinch grip test. So what I'm going to have the patient do is go tip to tip with the thumb and the pointer finger, just like this. So this would be a negative sign. A positive sign would be if you went pad to pad, so more like this. Okay, this is the rotary stability test. So I'm going to have the patient's arm flexed to about 130 degrees with full supination. I'm going to be applying an axial load at the same time a valgus stress force. All right, and I'm going to look at the patient's face to see if there's any apprehension and any feelings that his elbow might dislocate. Any problems there? This is the first upper limb tension test. I'm going to have the patient in about 110 degrees of abduction. I'm going to have the elbow flexed, and I'm going to get in a good position to extend the fingers and the wrist. I'm going to stabilize the scapula so that it doesn't elevate. And I'm going to extend the patient's elbow. Any pain there? And we're looking for pain along the median nerve distribution. And then if there's not reproduction of symptoms here, we can also ask the patient to rotate their head to the opposite side. Nice job. And try that again. Does that feel okay there? Okay. All right, this is the second upper limb tension test. It's going to be similar to the first one. We're doing median nerve distribution. So we're going to have the patient's arm in a slightly abducted position, elbow flexed to start, and we're going to keep the fingers and wrist extended. And we're just going to be moving them into extension. Any pain there? Okay, and we can do the same thing and ask the patient to rotate their head to the opposite side, and this might put more tension. Okay. Any pain there?
No.
Okay. And again, we're looking at pain along the median nerve. This is the third upper limb tension test. And I'm going to try this with my non-dominant hand so that we can see in the video here. But we're going to start in slight abduction, elbow flexed, wrist flexed, fingers flexed. And I'm going to be bringing the patient into elbow extension and some ulnar deviation. Okay, ready? Try it again. And we're looking for symptoms along the radial nerve distribution. And if that didn't show any symptoms, then we can go ahead and have the patient rotate his head like we've been doing before. And yes, numbness and tingling is what we're looking for there. All right, this is the fourth upper limb tension test. So we're going to be starting in a position that's similar to the first test that we did. We're going to be in 110 degrees of abduction, but this time we're going to start with the elbow extended, the wrist extended, and the fingers extended. I'm going to go ahead and stabilize at the scapula again. I'm going to be bringing the patient up into elbow flexion. Okay. And we're looking for any numbness, tingling, or pain along the ulnar nerve. Feel okay?